So what is the top part of the heart where all the vessels come in? This is called the base, right? And then the point at the bottom, down here, this is called the apex, right? So on these hearts, sometimes you can find it, a little piece of it. There's a little piece right here. You can see this kind of thick membrane. This originally surrounded the entire heart, and when you take the heart out, it's really hard to keep it intact. This is the pericardial sac. And normally, like I said, it surrounds the heart, it's filled with pericardial fluid. And the purpose of the sac is that it cushions the heart, and it prevents it from rubbing on the inside of the lungs, so it kind of gets down that friction. So you also have this sort of covering that's closely adhered to the surface of the heart. I can't really remove it. Covers the whole surface. This is called the epicardium, right? And as I open the heart, lining the inside of the chambers, making that smooth and shiny, I have the endocardium, right? And then making up the muscle of the heart itself, would all be myocardium. Okay, so the interventricular septum, the walls of the heart, these are all made of myocardium. Alright, so I already kind of mentioned it, but how do you tell left from right and front from back on the heart? So when it comes to telling the front from the back, what I always look for on the front is this guy right here, this pulmonary trunk. So if you flip it on the back, you can see there's nothing that looks like that in the back. Okay. But on the front, you get this nice, clear pulmonary trunk across the front. So we can also see right here, actually you can see there's one on the back too, what wraps around, so I guess it's technically the same one. This right here is the atrioventricular septum. And what the atrioventricular septum does is it kind of gives us a nice little guide to where the atria and the ventricles meet. Okay, so this is kind of like an outside view where you can see where the atria, anything above here would be atria, and anything below it would be ventricles, where they meet. So there's atrioventricular groove, which we see from the outside. And then when we open it, this right here is the interventricular septum. And this is what separates the left and the right ventricles. Okay. So this is atrioventricular because it separates the atrioventricular groove because it separates the atria and the ventricles. And here is interventricular septum because it separates the ventricles. So now talking about how we tell left from right. So how do you tell left from right here? What do you look at? Yeah, you have much thicker muscle wall on the left side, right, than on the right side. You see the right side is pretty thin. That's because the right side of the heart, where does this pump blood to? The lungs, right? As you remember from the cat, the lungs are just on either side of the heart. So they don't have to go very far. So you don't need a lot of muscle power behind that. Now, the left side of the heart, on the other hand, has to pump to throughout the body, right? So from the tip of your head to the tip of your toes. So you need a lot more muscle behind the left side of the heart. So now let's look at the chambers. So this chamber up here, this kind of round one, this is the left atrium. Okay. And then it pumps past this valve right here, and this is the bicuspid valve. So it pumps past the bicuspid valve into the left ventricle. But let's break this valve down a little bit more. So between the atria and the ventricles on either the left or the right side of the heart, you have these valves that are the cusped valves, meaning they have these little cusps here, okay? And these cusps are anchored into the ventricle by these strings right here. And what are these things called? These little stringy things? Yeah, the chordae tendineae. So if you've ever heard of anybody having a prolapse valve, that means something went wrong with these chordae tendineae or something went wrong that allowed these valves to, instead of being pulled into the ventricle, they flip back up into the atrium. So that's what a prolapse valve is. And these chordae tendineae, do their best to prevent that valve from prolapsing, so they keep them anchored into the ventricles. Now anchoring these chordae tendineae into the ventricle, you can see this right here, there's a nice one cross section, and here's a big one down here too. These are the papillary muscles. So they're the what keep the chordae tendineae in the ventricles. And this one I really like because you can actually see where the chordae tendineae is anchored into it. See the little end of it right here going into the papillary muscle. So the blood then passes from the left ventricle through this valve into the aorta. So this would make this the aortic semilunar valve. And these aortic semilunar valves are the aortic semilunar valve and the other semilunar valve we'll talk about in a moment do not have the chordae tendineae. Okay, they're just little bands of tissue. So from the left ventricle past the aortic semilunar valve into, we put my probe through this guy, through the aorta. Okay, so the aorta is this very large vessel here that comes straight out of the top of the heart. And maybe a little hard for me to show you from a top-down view because this thing doesn't really focus that close. But this is the aorta. So people will ask me about, well, what's this vessel right here? This is the brachiocephalic artery. Don't worry about this. I'm not going to ask you on the test. But you'll have to know it on the counts. Okay. But this big guy right here, coming out the top, is the aorta. So if you get confused between the brachiocephalic and the aorta, just look. The aorta is much bigger than the brachiocephalic. Okay. So now, if we look it up, pull it up in here. But actually, let's talk about this first. So the aorta is going to bring the blood and supply it to the body. Okay, so from the aorta to arteries, arterioles, venules. Arterioles, capillaries where you get gas exchange. Then into venules, into veins, and say that blood. Let's say that blood flowed through the top of part of your body above the heart, and now it's going to return to your heart. How does it enter into the heart? Through what vessel? If it's coming back to the heart from above the heart, it comes in through the superior vena cava, right? If it's coming in from below the heart, it comes in through the inferior vena cava. But what if that blood ran through the heart muscle? You can see you got these vessels here, right? So if it's dumping back into the heart after running through the heart muscle itself, then what is it coming through? The coronary sinus. Do you guys remember that one? Okay. So I do not know what happened to my heart that had an inferior and superior vena cava. I think they must have gotten rid of a couple of hearts from previous years. So I don't think I really have an inferior and superior vena cava that we can really see on any of the hearts that are in that bucket. I really looked hard, didn't have any luck. But I'm going to check again. Maybe I already dug through them between classes, so I know none of those do. There may be some in the closet that do, but I haven't had a chance to look yet. So if I do find a heart with a superior inferior vena cava, I'll show it to you next week. But for now, we're just going to say we can't see them, but normally you would see them on the back side of the heart. And then somewhere in here is where you find the coronary sinus. It's internal, so it would be something I don't think I could really pin on the heart. But we'll talk a little bit more about it next week. So when the blood enters in back to the heart from the superior vena cava, the inferior vena cava, or the coronary sinus, it dumps into this guy right here, which is the right atrium. And then it gets pumped past this valve right here. And this valve is the tricuspid valve. You can see it's a lot smaller than the bicuspid valve. So the tricuspid valve, blood passes from the right atrium through that tricuspid valve into the right ventricle. And then from this right ventricle, it's going to get pumped to the lungs. But to do that, it has to pass out through this. You see, it's always a little hard to find. But this guy right here, and this is the pulmonary central semilunar valve. And the pulmonary semilunar valve is between the right ventricle and then this guy right here, which is, what did I tell you it was before? This is the pulmonary trunk. Okay. So remember, the pulmonary trunk enters into the pulmonary arteries, which go to the lungs. Okay. Drops off carbon dioxide, picks up oxygen, and then the blood that's now oxygenated returns to the heart to get pumped to the rest of the body. And it does that by entering into one of these guys right here, which is called the pulmonary vein. So I'm putting my finger in here, and you can see it look around and open up. You can see it empties into the left ventricle. I'm sorry, the left atrium. It's not my atrium ventricles tonight. So from the pulmonary veins into the left atrium. So people usually like to say, okay, so what can we talk about that's always true about arteries and veins? Arteries always carry blood away from the heart, and veins always carry blood to the heart. But people sometimes like to say, oh, arteries always carry oxygenated blood, veins carry deoxygenated blood, which is not true. Right? I just talked about these pulmonary veins. They're carrying blood to the heart, okay, so that fits what we know. But they're carrying oxygenated blood, right? Because they're returning the blood from the lungs to the heart. So never say veins always carry deoxygenated blood, because you've got the exception of the pulmonary veins. On the flip side, people also like to say arteries always carry oxygenated blood. But remember, when the blood enters or is leaving through this pulmonary trunk, it branches out into the pulmonary arteries, which are carrying deoxygenated blood to the lungs. Okay, so pulmonary arteries carry deoxygenated blood. It's carrying it away, okay, but it's deoxygenated. So I think that is everything for the heart. Like I said, next week I'll see if we have any old parts back there that have the inferior and superior vein